So today, all right. So Delegate already introduced some work I do. So as a faculty who have been here for only 15 months, I came in, I was so amazed for all those incredible friendship and support from inside and outside of MSU and local communities. And I will show you why. And my work primarily using different technologies to develop those user-friendly, developmentally, linguistically, and cultural congruent interventions to encourage behavior, to promote behavior and mental health well-being. And today, I'm going to show you two different examples, how we leverage those technology to work with different populations to promote HPV vaccination among youth. By the way, HPV stands for human papillomavirus, just in case if you are curious. And it get really easy to mix, confuse with HIV. So I got those questions all the time, including my own boys. And okay, there we go. All right. And so usually when I do some prevention or have some talk, try to engage a community or clinical partners or parents, and they always, the question I got asked all the time is, do they work? All right. Well, luckily, so we have doing over years, we have done a lot of pilots, and including one of the ongoing studies that we're working with MSU pediatric clinics, 4 different sites in the Great Lansing areas. The study is funded by National Institute of Health. And those pilot study findings indicate those low cost and scalable interventions have shown effects in increasing the knowledge and awareness of the disease and the vaccine. It also promotes positive attitudes by addressing the vaccine hesitancy. And most importantly, those interventions have boosted the vaccine intention and uptake. That's the desired behavior we would like, use or everybody to get to protect their own health. So just give you some example, we just published an article from the study we work with the Vietnamese immigrant mothers. So in this pilot study, actually 2 pilot studies, one of the very first studies, 100% of those Vietnamese mothers who watch the stories that you will get a slim of that later, said that yes, they are going to vaccinate their kids against the cancer. And the 2 main reasons is because it protects my kids. And the other thing is because I want them to be healthy. So those are 2 main reasons. And in the second pilot, we also measure the vaccination intake. So for those kids, before they reach, if they get the first shot before they turn 15, they only need 2 shots. And if they get the first one after they turn 15, unfortunately, they will need to get 3. So we really try to push them to get those prevention measures as early as possible. So in the second pilot, 56% of those moms said their kids got the first shot of HPV vaccine, at 2 months follow-up. So we are very pleased for that, and we're still doing the follow-up work. Okay. So why HPV vaccine? There's so many different vaccines out there. Why do we focus on this one? Mainly because it's not mandatory vaccine. Kids do not to have this vaccine for the school requirement. And also HPV infection is really the most common sexually transmitted infection in the US and globally. And also is related to 6 types of cancers and affects everybody, males and females. So over 42 million of Americans are infected with certain types of, HPV, and that can cause different diseases, including cancers. 30 million people, including youth, are infected every year. And those data are from, the Centers for Disease Control and Prevention. The annual deaths attributed to HPV-related cancer is over 7,000. And stunningly, it also causes substantial economic burden equal to $3.8 billion annually in the United States. We could have saved all those money and use it in other meaningful ways if we do our prevention work well. While HPV vaccine is widely available and effective, the completion rate is definitely beyond, really low, really significant below what's the national goal is 80%. And I want to show you an example. So one of the reasons we choose to work with the Vietnamese immigrant family because Vietnamese females had the highest rate of HPV-related cervical cancer mortality. And their vaccination completion rate, we don't have a national statistics because all those national statistics do not break out, by specific racial ethnic groups. And so we got those data from descriptive study from local people, maybe in Texas or California, from the population baseline. It's 9%, and the national goal is 80%. So you definitely see the big health disparities in this area, and that also means that it's a huge room for improvement. So we work with youth, hopefully, they get their first vaccine to protect themselves at age 11 or 12. And CDC also recommends that they can actually start the vaccine at age 9. But reality, when I talk to the parents about, the parent with 9-year-olds, it's really challenging for them to see the connection between HPV and the need of the vaccination, because kids are not in puberty yet. And we also definitely include their caregivers and parents because the important role in health decision-making. We also specifically working with immigrant and refugee population because the limited English proficiency, the lack of knowledge and wellness, and believe that vaccination can probably encourage children's premarital sex. But I can tell you with the evidence that we have tested that hypothesis, none of the evidence indicate that there's any relationship between kids who get vaccine or they would do their premarital sex earlier than parents want to see. And this is the first thing I want to show you. So this is the fun part. I wish I can show you the game, and so you can actually play that. So the game is called HPV detective game, and we co-developed this game with our youth and their caregivers and healthcare providers and community advocate groups all together, and we have done several series of pilot testing. And so in this detective game, we put it in the waiting room at a clinical setting. May I ask, what's the average time that you wait to be seen before you see your provider? I'm sorry, I have to turn my back. I'm sorry. 3 months. That's definitely insane, 3 months. Anybody else? 30 minutes is probably the average time. Anybody have a very positive experience that you get there, you got to see in 1 second? No, okay. So we heard from my personal experiences as well, that we heard that it's about, in average, 15 to 30 minutes before you see your provider. And what do you do when you are waiting? What do people do?
Go on Instagram.
On the phone, right? Or on some devices, doing something fun, right? Update your social media, the pictures, share how fun the tour is, right? All those things. Okay, so just one day, I was waiting. I was with my younger boy. It was like 90 minutes wait. And then I was thinking that everybody is so busy with their phone and devices to entertain themselves, right? And then why don't we create something fun and engaging for our patient population to really turn that moment to be a teachable moment? And so they get the knowledge, they get the tools, they get motivation to communicate with their providers. So in the waiting room. So that's how we get started with this series of intervention. So fortunately, we have the funding, we have the right people, including the youth and parents. I can tell you how excited when they were involved in this intervention development, because usually they will tell you, nobody bother care about what they think, right? And I don't really feel like, I think even, for 9 years old, they have the right to be engaged in a meaningful discussion for their health care, because they are the recipients of the vaccines and nobody tell them what it's for. And the only thing they feel is, ouch, oh, it's so painful. I don't need another one of that. So that's how we get started. And the second one I want to share with you is the digital storytelling. So storytelling has been a traditional cultural practice for many minority and marginalized communities. It's a way to communicate and pass the cultural elements and the tradition to the next generation. We choose storytelling specifically is because it's a community-based participatory method to communicate culturally relevant health messages. The participants who went through that workshop to create the stories, and also the people who watch the stories tell us it promotes the feelings of empowerment, sense of self-efficacy, and had really strengthened their perception of social support to promote positive behaviors. So I'm going to give you a brief snapshot of how the story looks like.
When I was 11 years old in Vietnam, the only thing that I was worried about is how to survive during the Vietnam War. Even during the war, my mom still brought me to a local health clinic to get vaccinated so I can be protected. My family came to America as refugees in 1991. I was so surprised that everyone has the family doctor and prevention care in this country. I have learned about HPV vaccines during Asian Pacific Community in Action's health fair, but I did not pay attention to it. My youngest daughter's doctor made me aware about the HPV vaccines for girls. My oldest daughter, who is now a nurse.
Okay, so we have to stop here, but yeah, more than welcome to reach me. I'm happy to show more. All right. So far we have co-developed 4 different stories with our Vietnamese immigrant mom with vaccinated kids, because we want to learn what really motivates you. What's your perception of HPV and the vaccine and the healthcare system here overall? What the challenges you encounter? How do you overcome those challenges? And most importantly, why do you decide to vaccinate your child? Okay, I know this is a very busy slide. I try to put all related projects that ongoing with my MSU colleagues and local communities, including schools, right on one slide. So I have been here for 15 months, and I can tell you how much I appreciate all those supports that I get from MSU Inside Out and the local communities to make this happen. So I want to highlight 2 of the projects, actually 3 maybe, on the slide. So for the HPV Innovative Videos College Students Project, we work with 8 undergraduate Spartans from 5 different disciplines, including nursing, biochem, and acting, engineering, what's the other one? Neuroscience. So it has been very exciting. We meet every month, and for them, so they group together, they create the scripts, and we are also working with the faculty and students in College of Communication of Arts and Sciences to put everything together. So very soon, I hope that some of our students will be able to see those videos very quickly. So those videos are designed by our students and for our students. And the other exciting projects that work together, you already see some of those collaborators in the video. They are also on the tour to work with school nurses and Michigan Department of Health and Human Services, Michigan Association of School Nurses, just to name a few, and to address children's chronic pain, mental health issues, and substance misuse issues. All right, so there's no way I do it together. We do everything, I do it myself. We do everything together. We always work with our key stakeholders. So you see some of the photos on the top. Those are people who really help us, getting those products happen and be able to use in the real world. And the bottom photos are some of my research team members. Okay, so I want to thank you all for your time and attention today. You know how much I appreciate the opportunity to share the work, and I look forward to continue collaborating and have the conversation with people as we work together to really promote public health and well-being in our communities. The other thing I want to share, I hope everybody can see that as a bus. And I would like to extend, I'm still, I haven't really completely recovered from this tour, as you can tell. I kind of lose my voice because, I overtalked and too excited. And I definitely think that, the people, all the support, the spirit on the bus is just remarkable, shared among us is remarkable. And I want to extend my heartfelt thanks to our president and all our colleagues who made the Spartan Bus Tour possible. They take extremely good care of us physically, mentally, and perhaps spiritually as well. And I haven't had the courage to stand on the scale to see how much pounds I gain, over the 3 days. Okay. And I feel like the first question when I got that notice, I feel like, why me? What did I do to deserve to be on the bus? If somebody can share that story with me. And I'm deeply honored and grateful that to have the opportunity to join the bus. Especially as a relatively new faculty here, this tour really provides me an invaluable opportunity to see, to talk, to engage with communities and really witness the incredible impact that MSU people have made across the state. It highlights MSU wide-reaching influence in areas such as healthcare and agriculture, education, economical development, and of course, environmental sustainability. So if you have any question, one of the really touching story on the bus is that we have a community member, her family have a deeply impacted by the chemical toxic PFAS. And if you have any question about PFAS, I will refer you to Dr. Angela Wilson sitting here. She can tell you whole the story and how terrible, how severely that impact our environment and human health. So I want to thank you again. Thank you for bringing me here. Thank you for helping me and supporting me to do it, the community engaged research and innovation. Thank you.